Thanks for being here. This is Aurora Health Alliance's first topical webinar of 2024, entitled New Immigrants, Information and Resources. My name is Jo Glaviano. My pronouns are she, hers, and I'm the program manager with Aurora Health Alliance. I want to first just introduce all the organizations that will be joining and speaking today. We've got International Rescue Committee. We have the Migrant Response Network from Aurora Economic Opportunity Center. We have the MIEL organization, Project Worthmore, Village Exchange Center, and again, Spanish interpretation by Community Language Cooperative. So I'm going to turn it over to Ndeye with International Rescue Committee, and I have your slides ready to go.
Oh, thank you, Jo. Hello all, my name is Ndeye, Ndao, and I am the Community Engagement Coordinator at the International Rescue Committee, and I am joined by my colleague who will be sharing about the health. Go ahead, Elisa.
Hi, I'm Alisia. I work as a health promoter here at the International Rescue Committee, and I'll be presenting more about the health requirements for refugees and asylees.
That works. Thank you so much. So at IRC, who we are, our mission is to help individuals whose lives and livelihoods have been shattered by conflict and disaster to survive, recover, and gain control of their future. That's our mission. Who do we serve? The population we serve are those individuals who have been forced to flee their home country because of war, conflict, or natural disaster. We also support individuals who are in their host communities and who are supporting the people who had to flee their home country. We also support those who are called internally displaced individuals. So those individuals who have to remain within their home or their communities, even though there is war or conflict, but they were not able to leave and flee to another country. So they're inside their home country, but they're internally displaced. Yes, now who is a refugee? A refugee is someone who has been forced to leave their home country because of persecution or the fear of being persecuted, because of their race, religion, nationality, because they belong to a particular social group, or because they belong to a certain political party. Now, unofficial entities such as the United Nations High Commissioner for Refugees, the UNHCR, determines whether the person seeking international protection meets the definition of the refugee. And refugees are granted legal status, the refugee status, by the USCIS, U.S. Citizenship and Immigration Services. Who are refugee eligible populations? So these populations are basically who the resettlement agencies can serve because of their status. So they are also called ORR, Office of Refugee and Resettlement Populations. So individuals who have those one of these statuses can be served by one of the resettlement agencies here in Colorado. So the first is refugees. Then you have asylees. So for asylees, they must meet refugee persecution requirement, and they have to be present in the United States or seek admission at a port of entry to be granted asylum by a U.S. immigration court. Then you have the URM, the unaccompanied refugee minors. Those are children who have been identified overseas and who are eligible for resettlement support, but they do not have a parent or somebody, a relative, to provide for their long-term care. So those are called unaccompanied refugee minors. Then you have Cuban Haitian parolees, and the parolee status is a discretionary authority that allows for the temporary entry into the U.S. for urgent humanitarian reason or crisis, or because it's a significant public benefit. Then you have the special immigrant visa holders, SIV, and usually those individuals are from Iraq or Afghanistan. And those are individuals who have worked during the war and have supported the United States. They were interpreters, they were doctors, they had certain titles where they worked closely with the United States government. Next slide. The other populations are victims of trafficking, VOTs. So victims are of certain crimes, individuals who have suffered mental or physical abuse and are helpful to law enforcement or government officials in the investigation or prosecution of some criminal activity. Then you have Uniting for Ukraine. So that's a program that recently started a few years ago after what happened in Ukraine. And Uniting for Ukraine provides a pathway for Ukrainian citizens and their immediate family members who are outside of the United States to come here in the US and stay temporarily for a 2-year period as parole. Now, Ukrainians participating in the Uniting for Ukraine program must have a supporter or sponsor here in the US who agrees to be able to provide that support when they arrive in the United States. Then you have the special immigrant juvenile, and this is for individuals who are under the age of 21, and for individuals who have been abused, neglected, or abandoned by one or both of their parents. Then you have the secondary migrant, and those are individuals who have migrated from another state and came to, for example, somebody who had a refugee status and lived in Michigan, and then they lived there for a couple of years, but then they transferred and came to Colorado and are still seeking services because of their refugee status. And because we can serve people for up to 5 years, they still may be eligible for some of our services. Next slide. Now, there are a few options for refugees. There is voluntary repatriation, meaning going back to their home country. There is local integration, meaning just staying where they are and integrate. And there's resettlement to a third country. Now, less than 1% of all refugees worldwide are resettled each year. And that is a very small number because there are over 150 million plus individuals right now who are refugees, internally displaced, or cannot claim a country as their country. And there are over 30 resettlement countries, and these are just a few that are listed where individuals can be resettled to. And the US is one of them, as you can see, Italy, Luxembourg, Romania, and other countries in the world. How do refugees get resettled to the US? Now, as I mentioned earlier, the United Nations High Commissioner for Refugee, UNHCR, is a big agency, and they only refer the most vulnerable cases in countries for resettlement. And that 1%, that's what it is. And it's only those most vulnerable cases. And most vulnerable cases is urgent medical needs, those individuals who need that, those survivors of violence or torture, children who are at risk, or women and girls who are at risk. Now, there are multiple agencies involved within the process, and those agencies are security agencies, FBI, who are doing the vetting process to make sure that individuals who are applying for their refugee status have not committed any crimes within their country or in other places. There are about 8 federal government agencies, 6 security databases, 5 separate background checks, 4 biometric security checks, 3 separate in-person interviews, 2 interagency security checks, and also a year that is 2 years at least waiting before approval. So that whole process sometimes can take 10 years or longer. And then once individuals are vetted, they are referred to one of the national resettlement agencies like IRC, African Community Center, Lutheran Family Services, or Jewish Family Services. Next slide. So the RAs right now here, as I mentioned, are Lutheran Family Services, IRC, African Community Center, and Jewish Family Services. So these agencies can serve refugees when they come to Colorado. Next slide. What is an asylee? An asylee is an alien. Again, this is not my definition. This is from USCIS. I don't like sometimes the terms that they use to define individuals who are coming into the country, but that's what it is. Hopefully they will change it one day. But according to USCIS, the definition of an asylee is an alien in the United States or at a port of entry who is found to be unable or unwilling to return to their country of origin or to seek protection of that country because of persecution or a well-founded fear of persecution because also of those different areas, because of race, nationality, religion, because they belong to a member, to a certain social group. So if they're a member of the LGBTQIA+, or because of their political opinion. So the similarities are because of the fear of persecution between an asylee and a refugee. However, for asylees, they have to be here in the United States or at a port of entry to be able to apply for that asylee status and then be granted status here. Whereas the refugee, they are granted asylum before they come to the United States. So we know when refugees are coming, whereas for asylees, most of the time they're walk-in clients. So they come into our office and provide their paperwork and say that they've been granted asylum. And that's when we can start providing services to them. Next slide. As far as proof of eligibility, in order to receive services, individuals must show that they are a refugee or an asylee or a parolee. And for eligibility questions, the Colorado Refugee Services Program has detailed information about the paperwork, but sometimes it can be really challenging, especially for Cuban Haitian entrants or other individuals who are parolees, because sometimes the documents is different than the documents that refugees have. As far as an agency, these are the core services that we provide, and our services are free. We don't charge our clients for any of these services because we receive funding that allow us to have staff members that provide these services. The first bucket is case management. And case management, that's where we take care of pre-arrival logistics, making sure that individuals have a home, making sure kids are enrolled in school and they are able to apply for public benefits. Then we have health services, which Alicia will share a little bit more about. Then we have our economic empowerment team, where we have employment specialists who will assist our clients in finding a job. They will provide job readiness training. They will provide ongoing budget. Also applying for English language acquisition, so referring them to Emily Griffith Technical College or other institutions that provide English services. Then we have our psychosocial support team and program where we provide digital literacy resources. We have services for survivors of torture. We have a family reunification program under our legal team. We have youth programs, also family mentors, and other psychosocial support programs. So these are the core services that all refugees that we serve are eligible for and can receive while as a client of ours. Okay. Now, the first 90 days of refugee resettlement is very short and dense because there's a lot of things happening within those 90 days once refugees come to the U.S. First, once the case is assigned to the National Service Centers before they come. So this first phase is before they come. That's where we as an agency will have to find housing, making sure the house is furnished, and we're providing the basic necessities. And that part is really critical because it's really hard to find housing, as you know, affordable housing here in Colorado. So our housing team works really, really hard to secure housing. And sometimes we may not be able to find long-term housing, so an apartment initially. So before the clients come, we're able to either put them in a hotel upon arrival for a short term or an extended stay, or an Airbnb where they can stay temporarily until we find a long-term housing, more secure housing. Then we have the airport pickup, making sure we go pick them up from the airport upon arrival with the support of volunteers and other staff members. We take them to their home, and then within the first week or two, there's that cultural orientation piece where we will refer them. We have a cultural orientation team that provide kind of like a US 101 course, crash course, just sharing about information about the US, the do's and don'ts, things about taxes, things about interaction with the police, etc. So basic information just to have people acquainted with this new lifestyle in this new place that they call home, which is the United States. Then we'll have the 24-hour home visits. So caseworkers will go check in on clients. We have our public benefit team who will assist our clients in applying for public benefit, applying for Social Security card to be able to eventually start working. There's that medical screening for individuals who need immunization or additional testing, or if individuals come with, some specific cases with trauma and also maybe some conditions, heart condition, brain condition, things like that. There are referral processes that we can do within the medical team. There's also the employment referral, so working with our clients to make sure that they're employed. ESL referral. And then after 30 days, we have to make sure that clients who have children, they are signed up for school, making sure kids are registered for school and have all the paperwork they need to make sure they'll be able to go to school. We show them a little bit about the community, if there's a cultural market, if there's a church, a mosque, or a spiritual place where they need to go to. We try to help with showing them how to get from home to those places, doing a little bit of transportation navigation, and also referral to additional needs as needed. And then there'll be the 90-day home visit. So within the 90 days, we hope that clients have a little bit of education about the US. Also, mental health and health is taken care of, and housing is taken care of, and also making sure they have a job. And after that, their case will be closed and they'll be able to take care of themselves, hopefully. Now, it's not because this is kind of like the goal. It doesn't apply to everyone because each individual is different and they can adapt to things differently compared to others. So ideally, this is just basically the journey, and each individual can adapt, and some people may take longer than the 90 days to find a job or find secure housing and things like that. But the ideal is within the 90 days to have checked all these boxes.
So moving on to refugee medical screenings, as Ndeye mentioned, all the different types of status. As long as clients are ORR eligible, they qualify for refugee medical screenings. And clients with specifically refugee medical status, this is a requirement. The US law and Department of Health and Human Services requires medical examination for all refugees upon being accepted to be resettled in the US. This examination is designed to identify individuals with those health concerns that prevent entry into US as defined by public health regulations, and the Center for Disease Control and Prevention is responsible for providing the technical instruction on these exams for the overseas medical documents, the overseas medical examination. And then this is also an opportunity for clients to receive such preventative medical interventions before coming to the US, such as immunizations and parasitic disease therapy, as well as malaria treatments. During this overseas initial medical exam process, which we'll learn about more in the next slide quick, they'll identify any Class A conditions, which are conditions that they are not allowed to legally travel, as well as Class B conditions, which are conditions that are serious and they will need to be identified with follow-up appointments upon arrival. The domestic medical exam itself is for newly arrived refugees, and anyone, again, with the ORR eligibility is welcome to the exam, but it's required for refugees. and this typically takes place within the first 90 days. However, if a client doesn't have any urgent medical needs due to the shortage of medical workers, as well as the influx of refugees, it's taking closer to 4 to 5 months. And during this appointment, it's a full comprehensive health exam as well as a mental health assessment. And they'll follow up on any health conditions identified overseas, as well as identify any potential public health importance flags, as well as any barriers that may impact their effectiveness in resettlement, such as job placement or school attendance or language training. And these domestic medical exams are performed at federally qualified health centers in Colorado, and all these guidelines are set by the Center for Disease Control. Next slide. So the overseas refugee medical exam itself is a 3-step process. 6 months before departure is what they call the visa medical examination. This is usually done by a board of physicians, either elected from the U.S. consulate or the IOM, the International Office of Migration. And they're looking for those Class A health conditions which prevent them from travel, as well as Class B and any other health concerns that need to be flagged for when they arrive to the U.S. The next medical examination is the pre-departure medical examination that happens typically 3 weeks before departure. This is when the refugees with Class B diseases and illnesses are flagged for not only in the country where they currently are. The resettlement agency is also notified about any people traveling with Class B conditions so that we can get them their necessary referrals. And then the final step is the fit to fly departure embarkation checks, which happen typically 24 to 48 hours before their departure to the United States. Next slide. And so the domestic medical screening is a very comprehensive physical exam, again, that will hit on a lot of communicable diseases and immunizations that are necessary for kids to be enrolled in school and help prevent general health. Some of them include hepatitis, HIV, lead screenings, malaria, STIs, TB, as well as a mental health screening. And if any of these are flagged for any of the refugees or ORR eligible clients, then necessary referrals are made after the domestic refugee health exam. Next slide. And so health coordination in connection to care. Resettlement agencies like us at the IRC ensure new refugees attend the refugee medical screening, as well as any pre-screening doctor's appointments that they might require. Refugees at the screening are connected to primary care and dental care after. Some of our main partners include Denver Health, Stride, CU Sheridan, and Clinica Thornton. But refugees can choose to receive healthcare anywhere they choose with any provider, any hospital. Care coordination after that initial medical screening is coordinated by the care coordinators at the respective health clinics, and refugee agencies' support is limited after that. However, we do help with home health visits for health education on how to take the bus to their appointments and how to schedule primary care, as well as some medical case management for some more complex cases with medical illnesses that are unique to the IRC. So what can you do? Refer any Asylee to the Colorado Refugee Service Program, find out what their needs are, provide assistance with helping them to understand their rights here in the United States is so important, as well as providing interpretation if you're able, in helping to build bridges and links with different service providers to improve the services we offer to refugees and asylees, as well as just volunteering in the community in any way that you might be capable to, and again, participate in policy making by advocating for asylees and refugees, as well as just generally staying connected, which you guys are already doing that here today. Thank you.
Great. Thank you, Ndeye and Alisia. I believe next up we have Christo and Kadi with the Aurora Economic Opportunity Center.
Hello, everyone. I believe Kadi's on as well. My name is Christo Luna. I'm with the Aurora Economic Opportunity Coalition. We're in Northwest Aurora, right off of Dayton and Colfax. And my coworker, Kadi, she's the Migrant Response Network Manager. I'll let Kadi introduce herself.
Hello, everyone. My name is Kadi Kouyate. I am the Migrant Response Network Manager. And as Christo said, we work together hand by hand, trying to support the newcomers in Colorado. I will let Christo go first, then I will go ahead after Christo.
Okay. Yeah, so Kadi and I are actually fairly new. We started in October of last year, and we kind of jumped right in. So our executive director is Mateos Alvarez, and we've been working really closely with him on the migrant kind of crisis in Aurora. So what we saw is that there was a lot of migrants from Mauritania coming in. So when Kadi and I first started, there was a lot of barriers to even communicate with them because they only speak Pular and French. When Kadi and I first started, there was a big focus on the Latino community, the Venezuelan, Spanish speakers, and that was the case for most organizations. But when we first started, a lot of people didn't know about this other group that just came in from Mauritania. And I was reading that, they were coming in from Texas and going to Chicago and going all over. And, a lot of them wound up right at our doorstep in Northwest Aurora. Village Exchange also deals a lot with them, Project Worthmore. They were all in our area for the longest time. And what we've been focusing on is providing them all sorts of resources. So as the health person, we partnered with Village Exchange, Walgreens, and we were trying to get everyone vaccinated. So at the time, we did a couple of COVID vaccination clinics at our building, and it was really just word of mouth. A lot of people came, got their incentives. It was a $100 incentive at the time, and we did those for a couple months. And those were really successful. People were happy. However, we were noticing that a lot of people, the migrants outside, that they were getting multiple vaccines, whether at Village Exchange, at our place, and we knew for a fact that people were getting over vaccinated for COVID. And that's also a problem all in itself, but a lot of them couldn't find work, so they kept coming back for that incentive. So what we ended up doing, we kind of shifted gears a little bit and wanted to take it from more of a health fair, like general health approach, and we reached out to Stride. And in February, we were able to get Stride to come out with their mobile clinic, just a big bus, and they were able to see a handful of our Mauritanians. They were completely overwhelmed that day. They also experienced the same thing, language barriers. They really couldn't communicate too well, and even filling out the forms. But some of them Mauritanians, that was the first time they ever had any medical attention since being here in the US. Some of them more than 6 months, some of them getting closer to a year, and they were just overjoyed with the services that were provided. Walgreens also came and did flu shots. And we've really been focusing on those social determinants of health, those general health screenings. We've gotten back with Stride, and they have been able to follow up with a lot of them because they actually had a handful of them had a lot of undiagnosed problems like diabetes, vision problems, hypertension. So that was amazing. And they have their language services as well, which has been really helpful. And the thing that we have been doing is we've been trying to be creative with our resources, because once upon a time you could go to Dayton and Colfax to find work. You could just roll up, and that's why people still stand out there and they flag down trucks and everything because they're looking for the cash work, physical labor throughout the day. And unfortunately, that's just not the case anymore. So we're trying to fill that space with health screening. Kadi's been doing a lot of legal assistance with asylum cases, and we're just trying to help everyone stay motivated because some of them have been here so long they still can't find work. They haven't been able to get health resources. They're waiting on their court cases, and a lot of the mental health concerns are starting to kick in. A lot of them are very depressed, just, underwhelmed about the situation, and, their American dream has shifted a little bit. And Kadi could elaborate more about that since she speaks French and deals with them more than me. But yeah, we've been having a rough time finding legal sources, people to partner with to help with asylum, and just kind of helping everyone stay motivated. So I'll turn it over to Kadi, and she could explain all the things she's been doing to help our Mauritanian groups.
Thank you, Christo. So actually, the Migrant Response Network was created due to the large influx that was created late 2022. And then the organization is supporting newcomers in Colorado who are mainly from West Africa and then Latino community too. So the majority of them, they're seeking asylum due to enduring persecution, discrimination, slavery, mistreatment, torture, and some imposition of Islamist rules too in the area that they're coming from. These asylum seekers, they're originally from Mauritania, Senegal, Gambia, and then Mali. So mainly West African. So many of them have now received formal education, as Christo explained. Signing the asylum paper are barely the first time or second time for some of them to hold a pen. So with some only attending Arabic school, these individuals are willing to stay in the US to safeguard their lives and secure freedom from racial, national authority, torture-related or political oppression in their home country. Situations are completely different from here, where you have the freedom, there is a free slavery here, so that's why they're all running over into US. Mauritania is already known for an extensive discrimination, slavery, and mistreatment against Black Mauritanians. From Senegal, Gambia, and then Mali, those countries are included in the list mainly due to the stem from fervent application of Muslim rule that discriminate against LGBTQ individual, and then some political situation that is also going on in Senegal right now. Mali particularly is central, from his central to Northern region, is known for Islamist control and is still under Islamist control. So leading to constant persecution, racism against Black and then Fulani population. So some of the solutions that the migrant response has accomplished in few projects facilitate the integration of these newcomers. We have been supporting them with legal assistance, as Christo says, when it comes to asylum application, helping them with their story, supporting them with work authorization, those that have already reached the 150 and 180 days, and those that have already payroll since they got lucky at the border camp and then they've been already payroll. Those ones, we have been supporting them with work authorization application as well. So as a second project, we also reach out to different partners in order to seek for opportunity and then transportation. So thankfully, we were able to get some transportation support from some of those nonprofit organizations that we are partnering with in order to support those newcomers that whether they are on Dayton Street or they're trying to look for opportunity in somewhere else around the town. We also collaborate with other partners with other collaborator, and then those that we are working with in order to support them with life skill classes, which include leadership classes, coaching classes, mentorship classes. And as Christo said, we also gonna try to provide them some mental health classes, because the lack of resources is just causing some mental health concern on some of them, because the American dream that they hired when they first step into the country is completely shifting now and is bringing most of them down. So this can cause some safety concern, because when there is a lack of resources for someone who's dreaming about America, and then he's here and then just trying to have a different life. So whether there is a solution or there is no solution, the person will always try to find a solution. And no matter what's gonna happen, they just not gonna care about the consequences. This is a safety concern. That's why we're trying to find mental health resources and then try to support them with those ones too, in order for them to be calmed down, and then just keep the hope within those 6 months to 7 months, 8 months, by the time that they get their work authorization, and then try to have some English skills in order to start working. So we also support, we also get into partnership with different different organizations too, in order to support them during the cold weather. So we're trying to gather donation and provide them jackets, gloves, shoes, clothing, hats, all the primary necessary stuff that they might need it in order to be outside and then look for opportunity, because not all of them have the financial resources to provide those ones. And then they cannot get into all the organization because they are so limited. They only go to church, mosque, and then some mom and pop shop, stuff like that. So they are so limited financially that they cannot afford to buy jackets, gloves, so shoes, all of those ones. So we gather all of those ones as a donation and also provide it to them. So they can be outside, healthy, and then in good condition to look for opportunities.
Thank you, Kadi. And the last thing I wanted to elaborate on is we've had a lot of amazing partners in Northwest Aurora, the other nonprofits. We've been able to also partner with Representative Jason Crow. We've had meetings with Senator Hickenlooper, Senator Bennett, and we've had a lot of support from the counties. They're really curious about the situation because Colfax divides Adams and Arapahoe. So we're dealing with both of their residents at the moment. So they've been really supportive with their health departments and giving us resources. And one thing our executive director has been trying to do the past couple of years is have a presence at the Capitol as well. And this month we have organized a Northwest Aurora Day at the Capitol. We're going to be bringing 30 people from the community, 10 nonprofit folks, 10 Latinos, and then 10 French or African descent people to the Capitol, or just we have meetings with the Aurora delegation. We're gonna have a full day tour, and we just want to bring more awareness to the Aurora area, what we're dealing with, and kind of the overflow effects of what Denver has been doing with the migrants as well. So we're really excited to have a presence at the Capitol, and we'll let you all know how it goes. And please let us know if you have any questions or we could elaborate on anything.
Yeah, we're trying to also support them with cooking classes, helping them understand that they're living on the mountain, all those food that they're getting from food distribution places, they don't have to throw away, because some of them, they don't know the food that they're getting. And then they're just putting them in the trash, while there are organic food like lettuce and stuff like that. We're providing them some coaching classes in order for them to understand that this is organic food and it is great for you. It keeps you healthy. So those are the life skill classes that we keep providing to them in order to just keep the spirit up, and then they can wait until those 6 months to 7 months in order to start working. Thank you.
Great. And I
Thank
think
you.
there's a couple more questions, if that's okay, if we have time.
Yeah,
One would
absolutely.
be, Asylee seekers are not eligible for Medicaid or refugee services. Is that correct? So a question about the status and the programs they're eligible for.
I am not expert in that field, but all I know from what I know from my own experience, before they've been granted the Asylee status, they should not be, actually, I'm just gonna correct that. Before they granted the Asylee status, they don't have a legal lawful status in the country, which is preventing them to benefit from the government. So once they approve as Asylee or whatever it is, after the asylum, they have their green card or whatever they have, they can definitely apply for public benefit because they definitely need help. Now, in which condition, that would depend on the county, on the authority that they're applying for, and then everything. You know, everybody has their own guideline and then specific requirement. But once they granted the asylum status, they're absolutely fine to apply for public assistance.
Thank you. Thank you, Christo and Kadi, very much for the information. And we will move on to the MIEL organization with Ivon.
Hi, thank you, everyone. Thank you, Christo and Kadi and Ndeye for the presentation and for the information. Even though we're so close, sometimes I feel like we learn so much from this type of presentation. So thank you for the opportunity. My name is Ivon Romo. I'm the founder and executive director for MIEL. And MIEL stands for, let's see, can you do the next slide, please? Sorry. Oh, MIEL stands for Mental Health, Immigration, Education, and Language. We work with migrants and refugees, mostly in Northwest Aurora. Our mission is focused on acknowledging the different cultures in our city and country. Through our 4 key pillars, we will empower all community members by providing equitable mental health, immigration, education, and language services. Oh, and I did want to mention that everything is in Spanish for whoever's interpreting at the bottom or on the side, so that if that makes it a little bit easier for everyone. Sorry. Thank you. Sorry. Next slide. So we actually just started, I work with the Department of Justice. Many of you might know me. Some of you are just meeting me for the first time, but I worked for the Department of Justice for a long time, and I ran a nonprofit, across a nonprofit about 5 years ago, which is when I started volunteering. So I volunteered for about 3 years before I started my own, January 2022. So we just turned 2 this January. And the last 2 years, we've focused mostly on providing workshops on the 4 key pillars. We've been blessed. We have, therapists that have helped us develop programs for our volunteers, vicarious trauma training. We've done cultural differences programs for parents and their kids. We work with with several schools, Vanguard Classical, the science and tech schools in Denver and Aurora. It's a 6-week program, which is called Los Dos Somos Uno. We go over mental health awareness, suicide prevention, bullying prevention, and again, cultural differences. And that program is for parents and kids. We also do a lot of Know Your Rights events, immigration sessions. Right now, we are working, thanks to the Rose Foundation, we're doing the TPS program, which is a temporary protection status. Sorry if I'm speaking too fast. The temporary protection status program with other organizations, including BAC, and we're helping recently arrived migrants. There's a long list of countries that qualify. One of them is Venezuela. And we basically help, through our navigators, get their paperwork submitted. And then an attorney calls them so they can get their work permit and their social security card. So they're here and they can get, their housing and everything, hopefully a job. So we're doing that. We've been doing that since the end of around December, the beginning of the year. We've also done, some IT program or workshops on how to get their driver's license for those that don't qualify for TPS, and citizenship classes as well. For education, we actually started with 1 English class at the Aurora Public Library, and right now we have 5 classes going. We have 2 during the week at night from 6 to 8, and we have 3 on Saturdays, level 1, 2, and 3. And almost always, whenever we start them, we have over, 100 people waitlisted, and we get calls almost every day about interest for English classes. So it's been really interesting. It's a great demand. So hopefully, I keep saying this, I want to start them on soon because we get so many people calling from like Thornton and other areas that are not able to come to Aurora to take the classes. Another thing that we've been working on is sector-specific English classes, classes for like childcare, for volunteers, for just a few classes specific to what they need to work on those areas, on those sectors, I guess. So we'll be offering those in the next few, let's say, weeks. We're hoping to get them started at the end of April. Another that we're going to get started, and I'm going to say this, the end of April, we're starting basic computer classes, public speaking classes, and they're all going to be in Spanish. Okay, we can do the next slide. Through all the workshops that we've done, the feedback that we've gotten, and through my own, all the volunteering that I did, I actually started the Qualified Community Leaders Program. So all of our volunteers, they do the programs, the classes, they don't have to pay anything, because since we're so new, we actually don't have a lot of funding, and I'm sure we all go through this. But we just recently started getting a little bit of funding. The TPS one was our biggest. And so the volunteers, we do the basic like spreadsheet and emails and English classes that we go over. What do you need, like when you table at events, what information, the resources that are available in the community. If someone needs a volunteer specific for a health fair, or if it's a resource academy. So we train, the volunteers to what they need, or if there's an organization that there's hiring for something specific, we can direct them to them. So that's a program that we recently started about 6 months ago, and it continues to grow. We actually have right now almost 40 volunteers. We've partnered with our Economic Opportunity Coalition, AEOC, as well as just recently the AEOC, the health fair that is going to be on April 30th. We're going to have a few volunteers there as well to support with the health fair. So now next slide. Another program that we started is our community catalog on WhatsApp. So after getting so many text messages on WhatsApp, I decided to create a group where we share resources. This was also about now 9 months, I'm going to say, that we started at 6 to 9 months, and it's been growing steadily. We have about 350 members. This group, we share resources from like housing opportunities, job opportunities, and any organization resource that you have. So if you have an event, a program, anything that you want me to share with the community, you can send it, email, text it to me, and we share it there. We have a MIEL volunteer or member that manages that group, and they send messages there from Monday through Saturday from 9 to 6. So feel free to send me anything you want us to share there. It's a great resource whenever we're doing an event. Go ahead with the next slide. These are some, I think I'm going too fast, sorry guys, but the next events that we have, I wanted to share with you guys. We're actually gonna have a TPS walking clinic for next week, just on the 26th to the 28th from 9 to 6. And I'll share that flyer after the meeting with you guys. We also have a ride and drive peloton, and I am gonna share the flyer because we're looking for resources for the community. We're gonna have any type of sports balls for the kids, and we actually have several cars, like electric cars that the community are gonna be able to drive, like Teslas, Ford, Chevys are gonna be there participating at the event. And the community is gonna be able to get more information as to how to, what are the benefits of having an electric car. And so this is to celebrate Earth Day and Day of the Kid, Dia del Niño, for April 28th. So I'll send that flyer as well. Again, the health fair for the 30th, and just National Night Out, with which I am collaborating with AEOC. We're partnering to do that event with our police department on August 1st. I believe that's it. These are some of the organizations since I started, through volunteering, thanks to the help to many. We have like 3 constant immigration attorneys that have been supporting us, several therapists that have helped us develop programs for the volunteers. We have helped, we've partnered, actually, we've done over 500 events. We've done over 100 workshops, all of them through volunteering. And these are the organizations that have helped us, collaborated with us, supported us. So I want to say thanks. I know a lot of you guys are here. And we have an office now here right next to our community connections. So we continue to work together. And I think it's so important. I didn't know there were nonprofit organizations, which is why I started doing this and which is why I left my job. So I love this. So thank you again for allowing me to be here and talk about what our services are. If you guys have any questions, I'm done with my presentation. Thank you.
Great. I think there are a few questions that perhaps we have time for now. How do we refer people to TPS workshops?
Oh, I can put the contact information on the
Okay.
chat. We do have a number specific for TPS.
Great, thank you.
Great. Thank you so much. Thank you, Ivon. All right. We are moving on to, apologies, Ivon, for the, here's the last slide there with Yvonne's contact information. And okay, next up we have Jane with Project Worthmore.
Hello, everyone. I am Jane with Project Worthmore. Alrighty, so Project Worthmore is a nonprofit started by Caroline and Frank in 2011, with our mission being to provide programs that foster community, build self-sufficiency, and increase quality of life among Denver area refugees. Our vision, a world in which all people are valued, included, and empowered. Next slide, please. So we serve refugees, we serve asylum seekers, we serve special immigrant visas, undocumented people, new citizens, other immigrants, newcomers, English language learners. Next, please. We have a diversity of people that come to us. We have people of different age, people from different countries, different languages, different religions, different education backgrounds, economic backgrounds, literacy, trauma. Next one, please. We do here at Project Worthmore have a food share, and it's called the UMA Food Share. We provide 2 to 4 fresh bags of food for our clients every week. This is fresh food, fresh vegetables, dry goods. The food is available to pick up from our offices. Our members or our clients do have a card that we give to them, and they can come show it and receive food twice a week. We deliver to our clients that are not able to make it. There's a way to apply and get delivered to you if you cannot make it. This is like single parents, single moms, single dads, or the elderly people. Next one, please. We do have a dental clinic, and the dental clinic caters for all our clients. Most of our clients are obviously immigrants, refugees. They do have Medicaid, so we do take that, and they can come in here for services. And the clients that don't have Medicaid are able to come as well for if they have an emergency. We do offer some emergency dental care. Next, please. We have a community navigation team, which is what I'm a part of. I'm part of the community navigators. And what we do here is we do offer all the public benefits. We do help people find housing. We do help people if they have legal issues. We don't have a lawyer in staff, but we do refer people out to Aurora, to legal services. We do help people navigate the healthcare system, bank accounts, pay bills, read mail. We have, whatever it is, if a client walks into our offices, we are open to exploring and finding resources for them. Next, please. We offer, in partnership with Emily Griffith, we offer English classes, and this is online or in person. We serve people regardless of their status. We have 5 levels of English classes, from beginner to all the way. We do train and help people prepare for citizenship exams. We do provide childcare to all our clients. If you come and you have your children, they can have someone watch them as you take our classes. We have English, we have 2 buildings. Where I'm currently sitting is where the dental clinic and the navigation sits. But behind us, we have an English building where the school is at. Next, please. We have a farm. This farm is run by our clients, our staff, who are probably part, most of our employees and most of our staff is our community. They are mostly people that were themselves refugees or immigrants. And so the farm is run by these people, who is us, immigrants and refugees, and we do grow fresh foods, and that food comes to our food bank. So most of our food is fresh from the farm or fresh from whatever sources we source. We try to stay away from the canned stuff. We try to stay with the fresh food, the healthy stuff. So we do run that farm. We have a lot of volunteers as well that support all of our programs. We have a lot of volunteers. Next slide, please. So the people and the countries of people we serve is below here. We have people from all these countries. You can see Mauritania, Afghanistan, Rwanda, Ethiopia, Vietnam, Thailand, Malaysia, Ivory Coast. And that's also represented in the staff. Our staff is from all these countries. So we believe in obviously serving people from, people serving their people. Once you make that next step, you're welcome to come here and work with us and help your communities. So I do speak Swahili, and I serve the Swahili speaking community over here. We have people that speak in the community navigation team. We have a Spanish speaker. She serves the Spanish community. We do have an Afghan person that serves the Dari, Pashto. We have a Burmese person that serves the Burmese client base. We have French speakers that serve the French speaking. We do not, we serve everybody, but at least we have those specific groups. So if someone walks in to us speaking only Swahili, someone would meet them and help them. If someone speaks only French, someone would be right there to meet them. Most of our clients is an outflow from IRC and all the other big resettlement agencies after the 5 years. After the 5 years, our doors are open and these people can come right through and get that other next step assistance. We do accept people as well that are not 5 years. Anyone is welcome, but mostly we are seeing people after the 5 year or the 1 year. If they can't go back to their resettlement agency, they flow in here and we help them with whatever it is they need. Ours is a short presentation. That's what we do. This right here is what we will be looking at once we build our new building. But currently we sit in an older, doesn't look that nice, but eventually we have dreams to look like this once the funding is found and once we can be able to upgrade. So you're welcome to ask questions. You're welcome to volunteer here. You're welcome to come around and see what we do. Every once a week, we accept different groups of people to come through, talk to us, see what we do, share ideas, network, and so on. That's it for Project Worthmore.
Jane, thank you so much. And thank you for sharing the work you do. And your building is amazing. So yes, thank you for sharing. All
Thank you.
right. I'd like to move on to Village Exchange Center just to make sure we've got enough time for folks to hear all of the great work. So Mireya, I'm going to pass it over to you.
Hi, thank you, Joel. Thank you, everybody, for being here. And thank you to the organizations that have presented, very informative. I'm Mireya Davila, and I'm the Senior Program Manager at the Village Exchange Center. The Village Exchange Center is located at 1609 Havana Street. So we're right in the heart of Northwest Aurora, near Havana and Colfax, very close to the other organizations that have spoke today. The mission of Village Exchange Center. The mission of the Village Exchange Center is it's a community center and multi-faith worship space that celebrates religious and cultural diversity by creating an inclusive environment where residents from all backgrounds can practice, interact, share, and develop together. We seek to assist the immigrant and refugee population to feel empowered, to use their existing strengths and unique perspectives to enrich the city's diverse and inclusive community. I just want to also say that we mainly serve immigrants and refugees, but we are open to anybody that walks in, anybody that walks into our doors. We're always happy to assist with anybody. Our doors are open to everyone. The Village Exchange Center was founded in 2017 by Amanda Blaurock and Marcel Naruki. They're our founder and our co-founder. The space was donated by St. Matthew's Lutheran Church. The land and the building were both donated. And in 2018, VEC becomes a hub for multiple community organizations and congregations. So we had various organizations housed here, and then we also had various worship groups that would come and worship here. And to date, we still have various worship groups that come and worship here on the weekends. In 2019, our village pantry was launched and it continues to grow into this year. We are continuing to grow. In 2020, we also launched multiple funds and we also launched our village farm. And 2013 to 2014, we are narrowing in on what we do. What does the Village Exchange do? The Village Exchange Center is a nonprofit organization formed to serve immigrants and refugees in the Aurora and Denver metro area. As a community center and multi-faith worship space, we seek to celebrate cultural and religious diversity by creating an inclusive environment where residents from all backgrounds interact, share, and develop together. We offer youth and adult programs and services, as well as cultural and multi-faith activities, both directly and through our partner organizations. So we also work with various organizations in the community. We've worked with MIEL, with the AEOC, and with various organizations that I'm sure are also in this meeting. And these are the programs that we offer at the Village Exchange Center. So I'll be touching on each of the programs that we offer. One of the programs that we offer is our leadership program. So we have various leadership programs, cultural navigators, natural helpers, young natural leaders. Our cultural navigators is a training program. So we hire people who have graduated from our natural helpers program. We hire them as contractors to help provide services to the families we serve here at VEC. At this time, we have 18 cultural navigators that we have as contractors who assist us with various of our programming as well as wraparound services. We also have our Natural Helpers program, which is a program that trains and equips volunteers to come into the community and assist with newly arrived immigrants in the community. So it's a program that trains volunteers who are interested with working with newly arrived immigrants in the community. And a component of the Natural Helpers is a Young Natural Leaders program. So it's very similar to the Natural Helpers program. However, it's geared towards the youth. We also have various community assistance programs. At this time, we are also helping with TPS. So very similar to what MIEL is doing. We are also doing TPS for Venezuelans. At this time, we've done about over 400 TPS intakes. So we do the intake application, and then from there, the case will be transferred to an attorney. We also have a program called the Low Wage Worker Fund program. The Low Wage Worker Fund program is a program for anybody who's been affected and diagnosed with COVID since mid-2022 to date, who live in Adams County and who were working at the time that they were diagnosed with COVID. If they're able to meet that criteria, they qualify for a stipend of $1,500. We are also working with the City and County of Denver and Impact Charitable to offer the BCAH program. So the BCAH program is also a financial assistance program for anybody who was also affected by COVID, who lives in the City and County of Denver, and who had children 17 years of age and younger. And they can qualify for a financial assistance of $1,000 to $1,500. And we also just recently received a grant through the City and County of Denver to assist with housing financial assistance for the immigrants who are being housed at the shelters. And so their time, as we all know, the time that they're able to spend at the shelter is very limited. And so we just recently received funding to do case management wraparound services with the immigrants at the local shelters and to provide assistance for deposit and for rental assistance for the first few months. Another one of our big programs is our COVID-19 vaccination clinics. Through January 31st, we vaccinated 7,031 individuals. And actually, I just checked our numbers. And as of today, we have done over 14,000 COVID-19 vaccinations. We're doing this in conjunction with various community organizations. We were doing a lot of vaccine clinics in the community. And at this time, we are still offering our vaccination clinics on site twice a week. And we are still offering a $100 incentive for anybody who has not received the COVID-19 vaccine and who has not previously received the incentive. It's $100. And those are every Tuesdays and Thursdays here at VEC, starting at 10 in the morning. Also, one of our biggest programs is our pantry. So far this year, we have distributed more than 88,000 pounds of food to the community. Our pantry has really grown. We have our pantry once a week, every Wednesday from 12 to 5. And currently we are seeing about 600 families each week come into our pantry. Really, there's no criteria to be able to come into our pantry. The only criteria is that you do have to pre-register and make an appointment. However, it's open to all counties. So there is no limitation on the county they live in. So it's open to all counties. Again, our pantry is every Wednesday from 12 to 5. And we are currently serving 500 to 600 families each week. Something that's unique about our pantry is that it is all ran by volunteers. The majority of the volunteers that come in are families that we have served through VEC. And so now they are volunteering in at our food pantry. Lastly, we have our village farm, which is actually located outside of the Stanley Marketplace. If you guys have I'm sure a lot of you are familiar with the Stanley Marketplace, but we do have our farm, which is located right at the back, near like the doors of the ice cream shop. But we currently grow produce there, and the produce that we grow there, it goes to our food pantry that we have here at VEC, and it also goes to the local African markets, and we also provide it to a local co-op who assists small business owners with building restaurants. We currently also provide produce to 5 different vendors, and we are currently offering an urban farming immersion program through our farm. So what the immersion program is a program that recruits refugees in the community. And it's an agriculture program, educational program that teaches everything about agriculture, how to grow produce. The program runs from May through October, and it pays $20 an hour, and it's twice a week, Thursdays and Fridays, and we're currently recruiting participants. If anybody is interested in the program, I could provide Joe maybe with the flyers about the our urban farming program. But like I said, it's a really great program that teaches skills on agriculture, and it pays $20 an hour. The criteria for that is that you do have to have a refugee status. And these are just a few pictures of our farm. So yeah, does anybody have any questions?
There was a question in the chat if someone needed help with housing and housing case management, who do they contact?
So the way the program currently works is we get the referrals through the city and county of Denver. So if most of the families that are currently being housed at the shelters, they are already being referred automatically through the city and county of Denver. So if they are staying at the shelter, somebody from one of the organizations that is assisting, which is Papagayo, Vive, and now Village Exchange Center, and I believe Catholic Charities. So what the city and county of Denver is doing is they're basically dividing all the families up among all the organizations. So somebody should reach out to them. Otherwise, they could reach out to our organization. I could leave my email, and I could, assist the family in figuring out which organization is helping them. And if nobody is helping them yet, then we could reach out to the city and county and have them be assigned to an organization.
Great, thank you.
Well, thanks everyone. I want to be respectful of your time, but we will probably stay on for a few more minutes if folks want to continue the conversation. I just want to say thank you again to International Rescue Committee, Aurora Economic Opportunity Center, MIEL organization, Project Worthmore, and Village Exchange Center for all the work you do and for your adaptability and flexibility and really serving the community. Thank you so much. Thank you all for being here. And yes, thanks for joining. Please stay well.